My name is Matthew Guilbault. I'm the Director of Government and Industry Affairs for PIA. PIA, as you may know, is a four-state association. We represent brokers and agents in New York, New Jersey, Connecticut, and New Hampshire. I have under my employ and supervision our Government and Industry Affairs staff, which, including myself, includes 3 attorneys and 2 technical staff. And we field literally hundreds of telephone calls and emails and questions from brokers and agents every single day. We like to think of ourselves as a resource for you to use. And in that vein, we're very happy and pleased to be able to present today's presentation. We also work collaboratively with our Resource Center, which is another layer of member service. And in that, I don't know how many people we have staffing the Resource Center, but I know they have a sizable portion of the upstairs office. And they also go through and answer your questions and answers. So if you are a member of PIA, if you're not using our Resource Center, you're not calling me or sending in your questions and answers, please do so on PPACA, on broker compensation, on commissions, on all the issues that affect you every single day. We are here for you to answer your questions. We like to think, and in fact, we have a motto and a trade, I don't know if we're trademarked, but a motto and a branding of think PIA first. Anything that happens in your office, please think PIA first. Use us as your first go-to. We collaborate with a number of other organizations out there. We read the press every single day. We read all the experts. We consolidate the information so that when you call, we can get those questions and answers to you immediately. So with that, we are obviously talking about a very important issue today. We're talking about the PPACA, and PIA is extremely pleased that you were able to take the time to come in and learn a little bit more about it. As you all know, on March 23rd of 2010, President Obama signed in the PPACA, and I think fairly characterized it will implement sweeping reforms to the United States healthcare system. Some states more so than New York. New York, as we all know, have a lot of the reforms already in place in terms of guaranteed issue and community rating and things of that nature, so you may not see a big change with regard to that, but there are other sweeping changes. One in particular that we're here to talk about today is the enactment to the healthcare exchanges, and we're all very interested in healthcare exchanges. The PPACA provides that each state shall establish a healthcare exchange. They set a deadline of 2014 according to the official information, but we all know states are charging ahead with healthcare exchanges in different forms and functions as we go along here, and we're here today to talk about the implementation in New York. Other states have, or all states have, 3 options when they talk about state insurance exchanges. The first option is they can do what New York did and establish their own. Really take the bull by the horns and get out in front of this thing and put it together. The second one is you can essentially kick the can down the road and let the federal government do it, and the federal government will step in with an FFE, a federally workable exchange where the feds actually run the exchange. And then the third option is you can use some sort of partnership between the states and the feds with regard to the exchange. The focus of the exchange and the focus of PPACA are on 2 issues. One, it is addressing the huge number, both in New York State and nationwide, of the number of uninsureds. The primary goal of PPACA has been characterized as reducing the uninsureds and, oh, by the way, reducing the cost of health care insurance for all. There's a number of provisions in which they do that. It is a highly charged political debate. We will not get into whether we think it's going to effectuate each one of those goals today. We will talk about the logistics of how the exchange works and what you need to know as an agent or a broker in terms of interacting with those exchanges, both on the small business side and the individual side, so that you will be prepared when this thing hits to be positioned to help your clients maneuver their way through the exchanges or around the exchanges, depending on how you do. As I indicated, New York has chosen to establish its own exchange. I have one of my attorneys, Campbell, Wallace, up here, who is our point person of PIA on the PPACA. And those of you who have written in and called in have probably talked to Campbell with regard to this. He literally lives, sleeps, and breathes PPACA and knows just about everything there is to know about it. And I will turn it over to Campbell to introduce our speaker today. Thank you.
Thank you. Attended, and it's great to see you all here. It's fantastic that we got such a great reception for this, and I think this goes to show that there is a huge level of curiosity and interest in what's going on. We decided to put this together after doing all the research. We've been tracking PPACA in the exchange for the past couple of years, and we've been putting information out, and we keep getting calls back from members saying, yeah, what's the real story? What's really going on? You know, I read this article and it says this, and I read another article and it says that, and I just don't know what to believe. And we thought there was no better way for the broker community who, you know, as Matthew alluded to earlier, you have to make it work, whether you like it or whether you don't. It's not about being right or wrong, it's about making it work and making it work for you. We thought there's no better way to help you all make it work than by bringing in one of the people who's in the exchange and actually has the answers and can tell you exactly what's going on and up to date. I mean, you know, we're doing this today with all the information that is coming out today. As Joe can tell you, the exchange is being put together as we speak. It's not in the wings waiting to come out. It is literally being built day by day by day. And we figure that having it at this time when we're getting closer to the actual implementation of it is most useful for you so that you can know the latest and greatest. And obviously, as it progresses, we'll make a point to stay in communication and give you the information that you need to know. So the person we'll be having today is Joe Muldoon. He's the Director of Broker Relations for the New York State Health Benefit Exchange. Joe comes from a very long insurance background with a substantial broker involvement in his career. Let's see here. 30 years of experience in the health insurance industry, VP of Sales for Jarden Group Services. He worked for SSA, which many of you in New York State know bridges the gap between the association world and also the insurance world also. So he really understands where we're coming from and where you're coming from also. Sales leadership and client relationships for GHI, United Health, and MVP Healthcare. So I think with that background, and then currently just being one of the key people in the exchange, Joe is the absolutely right person to let you all know what we have to know and what the truth is out there. And with that, without any further ado, I'd like to introduce Joe.